Can genetics explain pain medication differences in colorectal cancer? Imagine two people with the same type of colorectal cancer and similar symptoms, yet they respond very differently to pain medications. Why does this happen? It turns out that genetics plays a big role in how each person experiences pain and how they respond to pain relief options. Our genes influence many aspects of pain management, from how drugs are processed to how pain signals are perceived. One of the main reasons for these differences involves genetic variations called polymorphisms. These are small changes in specific genes that can affect how our bodies handle medications. For example, the gene called OPM1 produces receptors in the brain and nervous system that opioids bind to in order to relieving pain. A common variation in this gene, known as the A118G polymorphism, has been linked to differences in how well patients respond to opioid therapy. Some people with certain versions of this gene may need higher doses to get the same pain relief, while others may find lower doses more effective. Another important gene is ABCB1, which encodes a protein that acts like a gatekeeper, transporting drugs across cell membranes. Variations in this gene, such as the 30 for 35 degrees Celsius T polymorphism, can influence how much of a pain medication like an opioid reaches its target. This means some patients might requiring more medication, while others need less, depending on their genetic makeup. Genes involved in drug metabolism, especially those in the CYP450 family, also affect how quickly the body breaks down pain medications. Faster metabolism can mean the drug wears off sooner, leading to less pain relief, while slower metabolism might cause increased side effects. Beyond how drugs are processed, genetics also influence how we perceive pain itself. During cancer treatments like chemotherapy, some patients experience more intense pain because of gene expression patterns. Certain genes involved in inflammation and immune responses, such as LILRA6, CACN6, and PRSS33, can become more active during treatment. When these genes are upregulated, they can heighten pain and discomfort, making pain management more challenging even with medication. Conversely, lower activity in these genes might mean less pain interference. In colorectal cancer patients receiving chemotherapy drugs like 5-fluorouracil, genetic differences can also affect side effects that cause pain. Variants in genes like TIMS, DPID, and GSDP1 influence how the body processes chemotherapy drugs. For instance, a mutation in the DPID gene can lead to increased nerve damage or neuropathy, which is a painful side effect. Variations in GSDP1 can also change the risk of mucositis or nerve pain, affecting how patients experience side effects. Knowing about these genetic differences opens the door to more personalized pain management. Doctors can perform pharmacogenetic testing to identify which gene variants a patient carries. This information helps them tailor medication doses or choose alternative strategies that work better for each individual. This approach reduces the frustrating trial and error process often involved in managing pain and can also minimize side effects caused by inappropriate dosing. While genetic testing for pain management is not yet routine for all colorectal cancer patients, research shows it has great potential. Recognizing that genetics influence how patients respond to pain medications encourages healthcare providers to consider personalized approaches. If you or someone you care about is struggling with pain control, discussing genetic testing options with your medical team might help find more effective, tailored solutions. Remember, everyone's experience with pain and medication is unique, and working closely with your healthcare team ensures the best possible management tailored to your individual needs.